Good morning, everyone. Thanks for taking the time to join us from the radio room in the Legislative Building in Regina. We have Premier Scott Moe as well as Health Minister Paul Merriman. We'll have opening remarks and then take time for questions. Premier?
Well, thank you, Matt, and good morning, everyone, and thank you for joining us here this morning. It's great for myself to be back in Regina here this week. As we know, the Omicron variant continues to spread, not only here in Saskatchewan, but across Canada and in many cases around the world. But we are now in a very different phase in this pandemic for a few reasons. First, lockdown and vaccinations do not seem to be stopping the transmission of the Omicron variant, but at the same time, we are seeing Omicron with a much quicker cycle of infection, and it seems to be less severe than previous strains, particularly if you are vaccinated and have your booster shot. And that's why we are now seeing in some countries, as well as some provinces across Canada, starting to discuss the removal of their remaining measures that they have in place, their public health measures. They're also starting to talk about how they're going to live with COVID as we move forward through the next number of weeks and months and ultimately into eternity, and how we are going to get our life back to a much more normal semblance of normal. We're not quite at that point yet here in Saskatchewan today, but we could be in the near future. Our hospitalizations our hospitalization admissions are rising, yes, but they remain lower than other provinces that have imposed a much stricter form of lockdown policies. And Saskatchewan's rate of fatalities from COVID remains to be one of the lowest in Canada. Today we have 262 patients that are in hospital with COVID. 26 of those are in ICU. Not all of these patients were admitted due to COVID. 113 of them were. 107 of those cases are incidental cases. Patients who were incidental cases are patients who were admitted for a different reason and then ultimately tested positive with COVID on their admission. But even if we look at the larger, more holistic numbers, Saskatchewan's current rate of hospitalizations and ICU admissions is below the national rate, as well, and is well below a number of provinces that have imposed much more stringent public health measures and much more stringent lockdowns than we have here in Saskatchewan. For instance, in the case of Quebec, the province that has likely the largest or most extreme lockdown policies in place in Canada, they currently have just under 40 hospitalization admissions per 100,000 people. That's nearly double the rate that we have here in Saskatchewan. Saskatchewan continues to have the lowest rate of COVID-related fatalities of any province throughout the month of January. Again, if we look to Quebec, the area of Canada that has the most stringent lockdown policies in place, they have over 1,000 COVID fatalities in January. That's about 7 times more than we have in Saskatchewan on a per capita basis, 7 times more. Omicron is spreading across Canada and spreading around the world regardless of the public health measures that are in place, which is why we have chosen to avoid increasing those public health measures and increasing the policies surrounding lockdowns here in Saskatchewan. We are not going to impose additional restrictions that cause significant harm for no significant benefit. I've also been challenged by some to provide evidence that lockdowns don't work. The evidence is right here in Saskatchewan as we manage through this Omicron wave with very little in the way of restrictions on people's lives. And we have lower rates of hospitalizations, lower rates of ICU admissions, and lower rates, thankfully, of fatalities through the month of January than many other provinces with much more severe restrictions. And we're avoiding the economic and psychological harm and the infringement on personal freedoms that are often caused by lockdowns. Listen, COVID is not going away. It's going to remain an ongoing concern for all of us. But we live with other diseases in our communities and in our province that are also ongoing concerns. We do this without locking down, without taking away people's freedoms, and without disrupting everyone's life. We need to make every effort to get to that point with COVID-19. It's encouraging to see other countries beginning to have that discussion as they begin to emerge from this Omicron wave. Now, there are things that we can all do and things I would put forward that we should do, and things that in many cases the vast majority of Saskatchewan people are already doing to protect ourselves and to reduce transmission and to help us continue to reduce the pressure on our hospitals. Most importantly, go out and get vaccinated, and then go out and get your booster shot. Being vaccinated does not help you from contracting COVID, but it should keep you from becoming seriously ill. That was certainly my personal experience. I really had a little, if any, symptoms at all, and felt quite good throughout my COVID infection. And I expect it might have been a lot worse had I not been fully vaccinated and I had not had my booster shot a couple of weeks prior. So we're fortunate in Saskatchewan where we have access to vaccines, and we also have access to our booster shots and have for some period of time. So I would encourage everyone to go out and avail themselves to those yet again. As I said, Saskatchewan not only has booster shots available, but we are one of the leaders in the country in delivering those booster shots. About 46% of those that are eligible residents over the age of 18 have now gotten their booster in this province. Most importantly, and more importantly even than that, about 74% of everyone over the age of 60 has gotten their booster shot in Saskatchewan. As we know, all too well in this province and across Canada, that elderly people are more likely to have serious outcomes when it comes to a COVID infection. So that high booster rate among our elderly residents is a tremendous layer of protection that is keeping a lot of people from becoming seriously ill and ultimately and possibly being hospitalized if they do contract COVID. The other important area where we are leading the country is in the distribution and the actual use of rapid tests, and I've seen this firsthand in the communities that I visited over the month of January. I saw this in my own case. Since I had no symptoms, I would never have known that I had COVID if I was not doing a rapid test on a regular basis. Rapid tests are widely available across this province. We'd asked everyone to have one in their place in their home. So pick them up and have them at home for when you need them. Rapid tests and booster shots are the two most important things that we can do right now in our battle against Omicron, and they certainly were helpful in my personal case. I only found out that I had COVID when I did a rapid test. And I had just gotten my booster a few weeks before. And as I said, I had hardly any symptoms, if any symptoms. And I also would say I understand that this is not going to be the case for everyone. And this is why we need to be vigilant and diligent in our efforts so that we can find our way through this Omicron wave without having a severe impact on our hospitals. We're going to continue to promote and deliver preventative measures that are effective in this province, effective at identifying the spread of COVID, and effective at preventing severe illness due to COVID. Tools like rapid tests and booster shots. So once again, I would just say thank you to everyone in Saskatchewan for everything you are doing to keep yourselves safe, to keep those around you safe, and ultimately to ensure that we're going to find our way through this Omicron wave. With that, I don't think you have any comments, Minister. We'll, if there's any questions, we'd be happy to take them.
Great, thank you, Premier. We'll start in the room. Mickey?
Yeah, sure. So I was wondering if you could give us an update how many government employees have signed on to help in our healthcare system, and are either of you willing to volunteer as well in terms of making food, making beds, taking people to the bathroom?
I'll just maybe a comment that I will make, and then Minister Merriman, maybe you can go into some more detail on all of the efforts and initiatives that we potentially have in place. Some are in place, some potentially would come into place should we need them to support our healthcare staff across this province. So where we are today in our healthcare system is we have just over 1,800 patients in beds across Saskatchewan. We have some additional pressures in Saskatoon and Regina, but we're trying to ensure that we can utilize our entire capacity across our provincial capacity across the healthcare system. This compares to a couple of years ago, just previous to COVID, the fourth quarter of 2019, which was the last full quarter we had previous to COVID. We had about 2,200 people in our hospital beds at that point in time. So we're a little bit lower than that, which is helpful as we find our our way through this. But we are ultimately having some pressures, and not only in our hospitals, but in our education system, in other private sectors that are the private sector that is offering services as well. And I think everyone is putting together, and Dr. Shahab had requested this a number of weeks ago, we should be putting together a plan as to how we can offer the services, in particular essential services like healthcare, given a staffing complement that ultimately is going to be reduced due to people self-isolating. Minister Merriman can speak a little bit to the percentages of what we're seeing in the healthcare system as well. But the public service note that went out this past week, I'll speak specific to that, is not actually in active today. What that is a scenario of planning should we ultimately need those folks that could come in and help with some of the administrative work. So it is a scenario plan. It's not a plan that has in any way been activated to date. And I haven't personally signed up for or been approached actually for shifts in my local facility. However, I have talked to a number of folks, nurses and such that are working in that facility, and we have a fairly good understanding of the challenges that, yes, they are going through, which is why we're ensuring that as we find our way through the next number of days and weeks, that we have all of the supports that we possibly can have in place to support our healthcare workers in the front lines. But do you want to speak, Minister, just a little bit to the percentage absenteeism that we have today, how that correlates, and some of the initiatives that we have in place should we need them?
Sure. Thanks, Premier. Traditionally, within our healthcare system, we have just over 13% absenteeism. That's a baseline back to 2019. Right now, we're just over 17%. So we've had a 4% increase. And that was a sharp increase in the first week of January, and since then has stabilized just above the 17%. But as Premier identified, we have seen almost an 18% decrease in our total hospitalization across the province. Right now, we're at 71 out of our 85 ICU beds are being used right now, and we have a provincial total of about 85% of the beds being used. So this is good. This is showing that we are prepared for what could be more people coming into the hospital system. But what we've also done, as identified by the Premier, is we've reached out to all levels of government to be able to see, if need be, what are we going to be able to bring in and draw on. Those people have volunteered for these positions on our GO teams. We have reached out to the public service as well as lots of retired people, non-traditional immunizers. We've reached out to all of these individuals to be able to prepare for what could be coming. We've also reached out to some international individuals that have applied to be either a nurse or an LPN or somewhere within our healthcare system to be able to see, can we work with the regulators to be able to move them up faster? Can we get them certified in a safe manner, making sure that we're maintaining the integrity of the healthcare system and the quality of care that our patients are expecting, but can we get them moved up faster? So we're reaching out to them this week. We're also reaching out to our our new Canadian communities, Global Gathering, to be able to see if there's any identified individuals. So we really are pulling in all hands to be able to make sure that we are prepared. None of these, not what the public service hasn't been activated yet, but we're preparing for it.
Do you have a follow-up, Mickey?
Yeah. So we're nearing record hospitalizations for acute care. Are we starting to see disruptions in healthcare services? And what's the first healthcare service that will likely be reduced? Because we've all been here before. I feel like we all know what's coming.
Go ahead.
Thanks, Premier. With Delta, we peaked at about 356 hospitalizations. Right now, we're at about 252, so we do have lots of room. Now, those are 252 individuals that are currently in hospital. Now, there's two levels of that. There are people that have come in with COVID that actually are presenting with COVID illnesses that the medical community has defined as this is a COVID illness, and then there's a lot of the other half. It's almost 50-50 now of incidental contacts. So again, we're trying to make sure that we have all hands on deck ready for what could be experiencing. We're not experiencing that now. The hospitalizations have increased, as Premier identified in his opening comments. But on the COVID-related illnesses, they are fairly stable in that 100 to 115 range. They seem to be leveling out there. Now, we're preparing to see if that number goes higher, as well as we're preparing within our ICUs. But we haven't seen that spike that the modeling anticipated a while ago.
Take our next question. Jeremy?
Yes, Premier, I just wanted to get your thoughts on the trucking convoy happening today. Are you supportive of what they're doing?
Well, I'd speak maybe more to the vaccine mandate that has been brought in by the federal government. I just say that we view this as being an unnecessary vaccine mandate for this particular industry for a number of reasons. First, the vast majority of our truckers, our transport guys, are vaccinated, like the vast majority of the general population. We've made every effort to make vaccines available for all Saskatchewan residents, including truckers. And if you go back to the early days of when vaccines were available, we had, alongside Manitoba, worked with Governor Burgum in North Dakota, which we graciously appreciate the effort that he had made to vaccinate Canadian truckers that were returning to Canada. And we had a number of checkpoints set up in North Dakota, south of the border, coming into both Saskatchewan and Manitoba, making those vaccines available for our international truckers that were returning to Saskatchewan and Manitoba. And again, we thank the people in North Dakota and Governor Burgum for his efforts way back probably about a year ago, actually, that we were doing that. So first and foremost, the vast majority of our truckers already are vaccinated. Second, we have tools available today in the way of rapid tests that our truckers can use. They didn't have these tools available to them a year ago either. And third, and I think as important as any of the other topics is, this is an essential service. These are the folks that are delivering our products, our food, in many cases, to our communities in Saskatchewan and in Canada, and they have operated safely throughout this pandemic, long before we had access to vaccines, long before we had many of the tools that are proving to be helpful and effective in our battle against the Omicron wave here today. Our truckers were going back and forth throughout this pandemic. They've done so, I think, largely in a very safe manner, and they are an essential service, and so we feel that the federal government, the policy that they've put forward, mandating vaccines for truckers to go back and forth across the border, it's an unnecessary policy, and it's one that's going to have, unfortunately, potentially some significant impacts on us accessing essential services, including food that we need in our communities.
Follow-up question, Jeremy?
Yes, I just want to go back because in December you kind of brought up we might bring in some kind of gathering restrictions. That hasn't happened, and that's not going to happen anytime soon from your perspective. What changed from December to now, like in that thought process and that decision making? Yeah,
I think we're getting a better understanding of the Omicron variant as it presented itself in a number of other areas around the world. Prior to, and even in Canada, prior to us managing our way through this Omicron wave in Saskatchewan. We have 113 people that are in hospital today in Saskatchewan due to the fact that they have Omicron. We are going to see increasing hospitalizations, likely increasing incidental hospitalizations as we have larger numbers of Omicron infections in our community. And I've talked to a number of people that have already had Omicron. So we are going to see larger hospitalizations as we move forward. Many of those are going to be incidental, likely a larger percentage than what we saw with a much more severe variant such as Delta. Further to that, what we are seeing in other areas of Canada and in various other areas around the world as well is that Omicron is much more infectious. It does, many more people contract Omicron than what we've seen in other waves, other variants that we have had here in Saskatchewan and other areas. And the public health measures that are being put in place, to the degree in some areas that are virtually locking down communities, they're still experiencing very high transmission rates and similarly levels of hospitalization ultimately. And so, the public health measures are very different, have a much lower effectiveness on a variant such as Omicron when it comes to the spread and ultimately the resulting hospitalizations that are there. And so what we have done is providing tools that we feel are effective, vaccines, access to boosters, rapid tests, and a credit to our Provincial Emergency Operations Centre, our PEOC Centre, for being a very early leader in accessing the rapid tests that have been available from the federal government and making those available to Saskatchewan residents. And we again encourage them to go out and get one. These are tools that allow us to one, identify COVID much quicker, and we are identifying it much quicker than in other areas of Canada, and then ultimately with your booster shot prevents you from getting as seriously ill. And as I said, that most certainly was my experience.
Take our next question. Lisa?
Your Chief Medical Health Officer, Dr. Sakif Shahab, has been saying for weeks that people should not be gathering, to not have many contacts at all. He's been saying that he believes hospitals and healthcare will be challenged. He said that last week. He thinks we're going to have the highest hospitalizations we've seen. So why are you not translating that into public health orders? Why are you, I guess, in essence, ignoring that advice from your Chief Medical Health Officer?
I would say that the government is not ignoring that advice, nor are Saskatchewan people ignoring that advice. People have slowed down their contacts with people. People have slowed down, and I've seen this firsthand. They're hosting people in their home, for example. People are taking that advice to heart. When you put in a public health order, you stop it all. And you stop, the couple of grandchildren from being able to safely do some rapid tests and go see their grandparents, for example. You stop all of those opportunities for people to see one another. And I would put forward that there are some significant consequences from doing just that as well, keeping families apart, keeping grandparents from their grandchildren. So what we are asking Saskatchewan people, and what I would put forward the vast majority of Saskatchewan people are doing, is they are slowing down their contacts, they are reducing their contacts, but when they feel that it is necessary, they are taking the precautions, using the tools that we have in place, so that they are able to see family members, for example, at a birthday or whatever that ultimately that occasion might be. What we're seeing in the way of hospitalizations in Saskatchewan today is we have fairly manageable hospitalizations relative to other areas of Canada. We have 113 people today that are in the hospital due to COVID. 262 would be our hospitalization number that will be reported here later today overall. And what we are doing, and what Minister Merriman had went through a couple of minutes ago, is making every effort to support our frontline healthcare workers that we know have an extra 113 people in there due to COVID, but are also challenged with the 3 or 4% absenteeism increase on the staffing side due to people that, through no fault of their own, are self-isolating due to having COVID. So we are looking at how we can bring in a number of international applicants into our facilities while they are waiting for the approval of their licensing through their regulatory body. Students have been brought in again to be utilized across the system. We have our GO teams have been put together and formed so that they can support facilities that may be going through an outbreak, for an example, with the staff that are working in that particular facility. As well as a number of other efforts, and the admin support was the letter that was highlighted earlier that had come out to, ask those in the public service if they would make themselves available to help on the administration side within our health authority, should it be needed. Again, some of those plans are activated, some of those plans are not activated as of yet, but they are in place should we need them ultimately in the weeks ahead. As I said earlier, we have 1,825 patients in our provincial hospital system today. The last quarter, as we went into the COVID just over 2 years ago, the last quarter of 2019, we had 2,200 patients in our provincial hospital system, more than we had in there today. But without the obvious staffing challenges that we have given Omicron. So our hospitals are full. And I don't think that's just a true statement in Saskatchewan. That's a statement across Canada that our hospitals are full generally. Given 3 years ago, 5 years ago, our health system has been one that has generally been operating at close to 100% capacity. This is one of the reasons that we have, and we're one of the provinces, along with all of the other provinces and territories, that we've asked the federal government to provide and to be a full funding partner through the Canada Health Transfer. There needs to be a significant increase from the federal government to properly support the provincially delivered healthcare systems that we have.
Follow-up question, Lisa?
You have said, other times you said today that gathering restrictions don't work. You're pointing out east where they have had record cases, but I'm just wondering how you're able to say that, because we don't necessarily know how many more cases there could have been had they not had gathering restrictions.
Right, which is likely a good reason to give some serious thought as to whether or not we should be implementing gathering restrictions, or whether anyone, and I won't speak to whether other jurisdictions, they'll make their decisions as they see. But we don't see the places where people are gathering, if they're putting in and utilizing the protocols that are in place, wearing your mask, ensuring where necessary there's a proof of vaccination, proof of negative test in place. We're not seeing those gatherings are having a significant impact on our numbers relative to other areas of Canada that have those public health measures in place. Some of the most challenging metrics when it comes to hospitalizations, ICUs, ultimately fatalities, is in the place of Quebec, where we arguably and have the most stringent lockdown measures that are in place, up to and including a curfew, where people were ultimately asked to stay in their home in the evenings. And we see some of the largest numbers, some of the largest hospitalizations, and ultimately some of the largest fatalities. When you compare Saskatchewan on just the hospitalizations per 100,000, we're just over 20. They're just under 40. They're virtually double where Saskatchewan is. In the case of fatalities, which is ultimately what we're all trying to avoid, we've had 20 during the month of January. We're at about 1.7 per 100,000. When you go to Quebec, that's about 12.5. It's significantly higher, about 7 times higher than where we are in Saskatchewan. And so, the lockdown policies, the increasing public health measures just don't seem to be stopping the spread of Omicron and ultimately the hospitalizations that we're seeing in other areas of Canada.
And we have some callers on the phone, so we'll take our first question on the line.
We have Murray Mandrick with Leader Post.
Good morning, Mr. Premier. I'm glad to see you're feeling better. I'm looking at the hospitalization numbers. They're 2.5 times what they were in your December 30th news conference. I'm looking at projections related to where the deaths are likely going, according to epidemiologists, and Saskatchewan is on the rise. I guess the question to ask, and you've said that you don't want to have the same measures as elsewhere, but who bears responsibility if these projections, if these continuing hospitalization rates continue to rise? Do you bear responsibility for the outcome of that, which could theoretically at least be the same as the Delta wave?
Omicron is ultimately, and COVID is ultimately responsible for what we're seeing in Saskatchewan, across Canada, and around the world. We continue to find ourselves in a global pandemic, and we continue to, you see, and if you're referencing some of the modeling that was released last week, we've often said it's a tool that ultimately Dr. Shahab looks at, as well as I think the Minister of Health and others are constantly looking at the modeling, among other pieces of information that are ultimately being channeled into the decision-making process. I think the modeling last week had said somewhere between 750 hospitalizations are in that neighborhood. Is that correct? We had modeling in late December, that was provided that indicated we'd probably be looking at 4,000 hospitalizations by mid-January, 2,000 in ICU. That's starting to be refined as we, and this is maybe to Jeremy's question earlier, as we find and learn more about how Omicron has, the Omicron variant has, impacted other areas of not only Canada but other areas of the world. I think as we go through time, the modeling becomes more concise, and ultimately, the decisions and the tools that we have available to us become. We try to leave those in place that are proving to be effective, like the access to vaccines, like the mandatory masking, like the access to rapid tests here in Saskatchewan. We encourage people to avail themselves to all of those tools. And when you look at Saskatchewan's numbers, and even if you say we're a few days behind or a week behind other areas of Canada, Saskatchewan's infection numbers, Saskatchewan's hospitalization numbers still remain some of the lower numbers across the nation.
You have a follow-up question, Murray?
No, I'll repeat my question in just a different matter for perhaps the answer that people are looking for. Obviously, Omicron is responsible or the reason people are getting sick, but government policies preventing the spread of that is what is in play in terms of the question. You're suggesting that it doesn't work here. It doesn't work here because it hasn't worked elsewhere, according to your thesis. Again, the projections elsewhere, national modeling, suggest that deaths are on the rise everywhere and will rise sharper in Saskatchewan. If that is the case, and if we have an opportunity to prevent that, and have an opportunity to prevent that through added measures, added restrictions, will you bear responsibility for the added cases?
The consequences of added measures need to be under consideration as well, as we have been through a very long, what is close to 2 years now, where people in Saskatchewan, maybe to a lesser degree than other areas of Canada, but people across Canada as well, have been, subject to a significant public health measures that have been put in place and remain in place today. And there will be, and there is consequences to those measures ultimately being in place. What you're seeing governments do across Canada and including the Saskatchewan government is to put forward and make available all of the tools that are ultimately effective in lowering our case counts, and then ultimately effective in turn in keeping our hospitalizations at a manageable level and as low as they ultimately can possibly be. There are tools that are available and have been available in Saskatchewan that I think we need to also understand are maybe not quite as available in other areas of Canada. We had booster shots opened up to the vast majority of Saskatchewan people earlier than other areas of Canada, and we actually continue to lead, be among the leaders in the percentage delivered of those booster doses, and in particular in folks that are over the age of 60, which is an important area to have those important demographic to have those booster shots ultimately taken up. The rapid tests. There's more rapid tests available in Saskatchewan per capita than anywhere else in the nation. Again, I credit to Marlowe and his team on having the foresight to procure as many of those as we could, as early as we could. And we have those available in Saskatchewan at a much greater level than I talked to a friend of mine from Medicine Hat who does not have access to a rapid test. I talked to a friend from Edmonton last night who does not have access to a rapid test at this point in time. Us in Saskatchewan, Saskatchewan residents, we're very fortunate that we do have access to those. So ultimately, Omicron is all of our enemy at this point in time. It is the variant of concern that we are dealing with. You're seeing governments, including the Saskatchewan government, make available all of the tools that we have, and we have a few additional tools in Saskatchewan that other areas may not have access to in the numbers that we do, and our metrics are remaining to be relatively low when compared to other provinces. That being said, and the Minister of Health had went through the efforts that some are in place today and activated, and some are in the planning process to ensure that we're supporting our frontline healthcare workers that have gone above and beyond for many months now, and we want to ensure that we're providing them as much support as possible in the days and weeks ahead.
We'll take our next question on the line.
We have Moises Canales-Levine with Global.
Hey, can you hear me?
You bet.
Good morning, everyone. Just wanted to ask about unions and just with the news with the SHA and the redeployment possibilities there. There are unions that have been speaking over the last few days. They're upset with the tasked with non-medical surge plan roles. We're just wondering, how deep are we reaching in the public service to fill these non-medical roles? And are we talking about SHA staff being deployed in the SHA, or having an agronomist, for example, being asked to clean bathrooms or to take on whatever roles are needed?
Yeah, Paul, you might want to speak a little bit to this. What I would say is we've done this before. We did this in previous waves where we have had to support our frontline healthcare staff that are providing services again. And I would just say this is a plan that is not activated at this point in time. As the Minister of Health has said, we have about 17% absenteeism in our healthcare system, up about 4% from where we normally are. This is a plan that is exactly that. It's a scenario plan. Should we need to enact it, we would, but it's not activated at this point in time. But do you want to speak a little more in depth to what you know about it, Minister?
Yeah, thanks, Premier. And as Premier has identified, we have done this before where we've had reduction of services. We've pulled people in, not just from the public service, but from other areas and of government to be able to backfill some of those positions. Now, we want to do that very strategically and surgically. Every time that we've had to be able to do this, like other provinces across the country, we get a little bit more refined on it, on what we need and where we need these individuals. So we're going to continue to be able to do that. But again, as Premier identified, our capacity or our staffing challenges is up 4% from a traditional year. But our hospital capacity is almost down 18%. As Premier identified, we have the capacity of 2,200 individuals in 2019, and now we have 1,825. Now, that number moves every day. But our capacity, we still have capacity within our healthcare system to be able to do this. So again, we'll only activate these plans if absolutely necessary, and we're going to be extremely surgical about it. We're going to make sure that we have the right people in the right places for the right amount of time. If somebody needs to come in and do a shift, then we're going to be able to do that. If somebody needs to have an extended period of time that we need to backfill, then we're going to do that as well. And then we're going to return them back to their original position as soon as possible.
Just a note on the provincial capacity and the ability and the efforts that are being made to utilize the full provincial bed capacity that we have and the full staffing complement that we have province-wide would have been very challenging in amongst a number of different health regions that we had just over 5 years ago. And so the bringing together of all of the health regions into the one provincial Saskatchewan Health Authority has proven to be a benefit on a number of fronts throughout this pandemic. In the unanimity of various policies and how we support one another across the province. The Minister has asked our Saskatchewan Health Authority, and for some time they've been working on a plan to ensure that we are utilizing all of our provincial bed capacity, which is significant. We understand that there's some challenges and I said earlier, right now in Saskatoon and Regina, where those facilities are operating at or likely slightly above their capacity, and so we would, I think, ask for a little bit of leniency and patience with families that may need care in those urban centres. We may have to move some of our family members out into a different location, for example, maybe a nearby rural community where we do have, beds available to ease some of the pressures and allow us to really utilize the full provincial capacity that we have, as opposed to just the two largest centres.
You have a follow-up, Moises?
Yeah, thanks. Just this one's for the Minister. We haven't seen you for a while. Last time was December 30th. And the COVID-19 situation in our province has changed quite a bit. I was just wondering if I can get your thoughts on it and why we haven't seen you for almost nearly a month at one of these COVID-19 updates.
Thanks very much for the question. Just because I'm not in front of the camera doesn't mean that I'm not working. I've been working diligently, as well as the staff that I get to work with throughout since I've been appointed as Minister of Health. I'll continue to do that. The Premier has been available. I've been doing media callbacks. I am available all the time to be able to make sure that I'm conveying the information. But just because you're not necessarily seeing me, you're seeing some of the team that I get to work with, Dr. Shahab, you're seeing the group from the PIOC that is keeping everybody very informed. But I can tell you that I've been in my office and been working and been on Zoom calls when I'm at home throughout this whole pandemic since I've had the privilege of being appointed as Health Minister.
I would just, at the risk of not witnessing and verifying the effort that both our health ministers, but in particular Minister Merriman, is making throughout Christmas and throughout January. I believe he was down here last week. He works out of our Saskatoon Cabinet office as well, as he resides in Saskatoon, and has been doing media callbacks as well. And I just take the opportunity to thank him for the effort that he's made, not just throughout Christmas and January, but throughout his time as health minister.
And we'll take our next question on the line.
We have Allison Bamford with CTV.
Hi there. Thanks for taking my question. Regina right now has its highest hospitalizations it's seen since November 23rd, I believe. And earlier you did say additional pressures are in both Regina and Saskatoon. I'm just wondering if anything right now is being done to ease any of those pressures, if that's either, patient transfers or shuffling staff around.
Yeah, thanks very much for the question, Alison. As the Premier identified, we're looking at load leveling across our system. For example, in Regina and Saskatoon, where are obviously our major tertiary centres, we are at or above our capacity. But if we look out into rural Saskatchewan, we have only approximately about 70% of our beds being used. So this is why we have to be able to make sure that we're utilizing our healthcare system to its full potential, not just in Saskatoon and Regina and the major centres, but we might have to move some patients out to those smaller centres to be able to make room if we need. But we're also complementing that with the staffing resources that have been identified already in this media avail to make sure that we have the right people in the right place. And sometimes that means that we might have to move a patient from one centre to another centre to be able to make room. We are at capacity in our two major centres, but provincially we're sitting at around 85%. So we have to start using our rural capacity. I know rural Saskatchewan is already stretched as far as some staffing challenges out there, but we need to be able to utilize those beds, and I know that the people on the front line will be able to rise to the occasion. But again, we're looking at the provincial capacity, not just what's happening in the two major centres.
A follow-up question, Allison?
Yeah, I'm just wondering how much weight do you put on incidental cases, knowing that they do create a higher workload for healthcare staff? And how is that, I guess, taken into consideration when looking at implementing the surge plan and service reduction?
So we must understand that these are individuals that would be in the hospital with or without COVID, as they are in for some other reason and tested positive on their entry. That being said, and it's a good point, Allison, once you test positive for COVID, there are some additional protocols ultimately that need to be in place to ensure that patient is cared for keeping those around them safe. So there is some additional protocols, some additional efforts that need to be made by individuals, even though they might not be in there and ill from COVID itself. And so it's important for all of us to understand that, and that's why the minister has put together a fairly fulsome plan with respect to how we can reach, across government across our communities as well, to support those healthcare staff that are in our facilities each and every day. Yes, caring for an additional 113 people that are in there due to COVID. but also offering additional care to the other 107 people that are in there but also have COVID. So it's this is really I think speaks to the efforts that our Minister of Health is leading, but through the Saskatchewan Health Authority as well as the Ministry of Health and ultimately our POC table, or Provincial Emergency Operations Center, on looking for the ability to bring international applicants into our facilities sooner rather than later, maybe not even working in their ultimate place where they are trained, but they do have healthcare training and could potentially come in and help in our facilities. Students have been employed throughout this pandemic on our vaccination teams, for example, which then allows others to be freed up in our healthcare system. Our GO teams are I believe they're out and ready to be deployed, and maybe some even are to support. To support various areas of service that might be challenged due to people that are ultimately self-isolating. And then obviously the public service call or ask that went out. Again, it's not activated as of yet, but it's to some degree some scenario planning to further support our frontline healthcare workers here in the province in the days and weeks ahead. And those staffing challenges are present in our facilities now. I talked to a young nurse in my home community, and a couple of them that spoke to some of the challenges that they're experiencing here and now, and how they're managing their way through that. And so to them and to many others, I think on behalf of both the minister and I, we say thank you for the effort that we know is happening day in, day out.
We'll take our next question on the line.
We have Adam Hunter with CBC.
Thanks for taking my question. I have a question related to the unreported deaths from last week. I'm wondering if either of you were at all curious as to why Saskatchewan was the only province not to record a death for a couple of weeks, and whether that has you concerned that we may have underreported deaths throughout the pandemic, as some research has shown that we may have missed a number of deaths.
Do you want to go first, Paul, and then I'll maybe go?
As far as the unreported deaths, this was a system error that was generated within between the SHA and the Ministry of Health. I found out about the information on Friday at 10 o'clock. To be able to go back and look at that, I mean, the doctors are the ones that report off on the cause of death, and we rely on them to be able to do that. The data entry position, sometimes there is going to be human error in this, but what I want to convey to people is the information that the Premier and I get, that we put out to everybody, are not modified in any way, shape, or form. We get this information from the Saskatchewan Health Authority, from the ministry, and then we put it. We're not in the hospitals. We're not doing the data entry. We are the ones that are conveying that information. So the information we get are the information that we pass on. And sometimes there is some data errors in that. We're working, just like every other province, to be able to make sure that we're giving out the best possible data in a timely manner. And we have to also be cognizant of, this is a lot of information that's being reported out on a daily basis, and there are people involved in this, and sometimes there are some errors in there. We accept that there was an error in reporting that. As soon as we found out about it, Dr. Shahab was out explaining the process on what had happened, so we're being extremely transparent with the people of Saskatchewan.
I would just add to that, Adam, it's not the first time that we've seen some errors around active cases. Some of the more so on the case counts in months gone by. I'd say we're extremely concerned with respect to the fact that there was additional fatalities that we weren't aware of, and I think, in fairness, many weren't aware of. But not concerned that there's additional fatalities that would not be reported. Ultimately, this was a system error that very quickly the Ministry, I believe, of Health was able to find and identify and ultimately correct. So it's explainable as to why ultimately this occurred. In the lead up to that, as we went a number of days, a couple of weeks without any fatality, there was questions being asked with respect to that by myself, by the Minister, Minister, as to why do we seem to be in this somewhat unique situation in Saskatchewan. And I think the answers at the time were given legitimately now that we understand the explainable data error that was there, but concerning that data error is there for certain. You'd mentioned as well with respect to I'll call it what it is, some misinformation around a number of other fatalities that may be associated with COVID here in Saskatchewan. I'm hearing numbers that are in the thousands. That simply is nothing more than misinformation, and it should be challenged. I would hope it's challenged by the media and by peers as well. In Saskatchewan, we have for a number of years now, we experience about 10,000 fatalities for all reasons across the province, and for someone to indicate that the majority of those are due to COVID is just simply nothing short of some of the most egregious misinformation that I've seen throughout this pandemic, and it really shouldn't be spread.
You have a follow-up question?
Should be challenged as well.
For the Premier, you mentioned off the top that certain jurisdictions are considering removing or changing measures based on how the Omicron variant plays out. I'm wondering if you could give us more detail on how that would look in Saskatchewan, any sort of timeline or idea of what measures would be the first to come down, what you're considering, and when that, I guess, what would trigger that?
Well, I think the number that we'll be looking for in Saskatchewan is a change in trajectory of our hospitalizations. Ultimately, that has been the number and the metric that we've been watching to date. Been looking at how that number stacks up against other provinces, how that number compares to other countries around the world as well. As far as our specific public health measures that we ultimately have in place, there's two: indoor masking, mandatory masking indoors, as well as the proof of vaccination, proof of negative test policy. And with those come some impacts. And I just share a personal story of a mother with a younger child that I spoke to last week, and it was with respect to the isolation policy, specifically around extracurricular activities, where an her son had been in contact 3 times during the last month or so, was able to continue to go to school, and she was, and they were very appreciative of that, to lend itself to some degree of normalcy, but wasn't able, for example, to play hockey, and had to take 3 different occasions a number of days away from playing hockey, and that was challenging for that family, and for that young individual, that's tough. It's tough for them, but thankfully they're able to continue to attend in school. But I think those are the type of consequences that are still occurring, even with the public health measures that we do have in place in Saskatchewan, that we really want to limit if we are able. And to limit the impact at this point, in particular on our youth. And I just share that as one example of some will say we don't have significant public health measures in place in Saskatchewan. I can tell you they're significant for that young individual.
And we'll take our next question on the line.
We have Phil Tank with Star Phoenix.
Yeah, I'd like to ask about incidental hospitalizations. When I first asked about this, when you first introduced this, first of all, can you hear me?
Yeah, we got you.
Yeah. When I first asked about this, I asked whether someone who is admitted to a hospital with a broken leg is going to be, and develops COVID and develops symptoms after that, is going to be tracked diligently. And I got a response that might happen. I guess I'm wondering how much confidence we should put into those statistics. Did they refer to people at the time of admission, or are you tracking those people? How much faith should we have in, when we see incidental, that these people are continuing not to show any symptoms at all?
My answer to that, Phil, would be, and the minister might have a few more details to add, but I would just ask you to ask that question when our PIOC committee makes themselves available, which I assume they will at some point this week. It's ultimately some of the details of that question they may even have to follow up with as well. But you do speak to some of the challenges and the nuances of why it was challenging, not just for Saskatchewan, but other areas of other provinces, provincial jurisdictions as well, to start separating out what illnesses, what hospitalizations are due to COVID versus what are incidental, and then what exactly does incidental ultimately mean. And we've all heard that someone would have a broken leg get tested when they go in there, and that would be the most incidental case ultimately that we would see. So on just where that is, and the interpretation of individual physicians, individuals, humans that are ultimately providing the care and making the assertion, there will be some differences from time to time. But I would say we defer that to and ask you, or we could follow up maybe with some information, or ask that at the PIOC table, or unless you have something to add, Minister.
The only thing I would add, Premier, to that is there was a clinical team put together that actually defined what a COVID-related admission was versus a non-COVID related and tested after. So this was a clinical led by Dr. Wasco that defined this process and implemented the process across the SHA. So it was their definition, certainly not ours, because we're not clinicians. They were able to make the determination, the definition, looking at districts across Canada and around the world as to what this definition would entail. So again, maybe Dr. Wasco or Dr. Shahab might be better to answer the clinical side of that. And do you have a follow-up, Phil?
Yeah, I'd like to ask about the Premier's, and by the way, good to see that you had a mild bout with COVID. I'd like to ask about the Premier's use of the word lockdown. The word lockdown has been adopted by anti-vaxxers and conspiracy theorists to refer to anything that, tries to stop the spread of COVID-19. In your opinion, have we ever had a lockdown in Saskatchewan? I mean, I know there were severe restrictions and businesses closed in, March or the spring of 2020, but, I don't feel I was ever told that you can't leave your house. I mean, lockdown is a prison term and it has a very negative connotation. So, when you use the word lockdown, are you appealing to those sorts of groups, or what do you mean when you use the word lockdown?
I think there's probably likely varying levels of what people consider a lockdown. I just shared a story of a young individual that at 3 different occasions has not been able to, play a sport that he loves. For him, that might be a lockdown. If he's not able to go to school as well, certainly from a child's perspective or a youth's perspective, they're not going to school. They're not going to their extracurricular sports. To them, that ultimately is a lockdown. We have been at one time, likely for the most part, province-wide, where we had, essentially we're down to essential services being over here in the province, and you were told how many people you may or may not have in your home. That to many people, I think, would be interpreted as a lockdown. If you look across Canada, where there are, in the case of Quebec, have been relative to Saskatchewan, rather extreme public health measures that have been put in place, up to and including a curfew for a period of time, and compiled on that not only proof of vaccination, proof of negative tests, but compiled on that some vaccine mandates in certain areas of society. Many would interpret that ultimately as a lockdown as well. What we are doing in Saskatchewan, and have spoken to this today and other days as well, is making every effort to make the tools that are effective available to Saskatchewan people. And what we are saying is those tools, vaccines, access to boosters, rapid tests, ultimately some moderate public health orders that are in place, such as indoor masking, some proof of vaccination policy or proof of negative test policy in certain areas of our society, are proving by the numbers to appear to be as effective with the Omicron variant, the Omicron wave, as those much more stringent public health measures that many people will interpret as ultimately lockdown policies. And I think for each of us, that interpretation is in many cases open to be different for everyone as an individual.
And we have time for one more set of questions.
We have Ryan Kessler with Global.
Good morning, and thank you for taking my questions. First of all, a follow-up regarding moving patients from Saskatoon and Regina to smaller centers. How close is the province to doing that? When will it start? Has it started already?
I just open that by saying we're at about 85% of our provincial capacity has a patient in the bed, and so we do have provincial capacity. And what I had said earlier is we would ask for some patience with families that have a patient if we would have to move them potentially to a neighboring community, so that we're able to utilize the full provincial capacity that we have and alleviate some of the pressures at this point in time that are in our urban centres. You want to speak in a little more detail, Minister?
Yeah, thanks, Premier. Again, we're not going to move people out without talking to themselves and talking to the family. This is a planned thing, that we're going to make sure that we don't overwhelm our major centres in Saskatoon, Regina, Prince Albert, Moose Jaw, Yorkton, Battleford, Swift Current. We're going to make sure that we load level across, because it doesn't make any sense for us to be in a position where we're over capacity in Saskatoon and Regina, yet there might be another hospital out in the system that isn't at capacity. So we got to make sure that we're doing that. Again, we're working with families to be able to say we might need to move an individual on a temporary basis. We're not there yet. But if things change and the hospitalization keeps moving up in our major centres, we will consider that, because we have to make sure that we're looking after overall patient care to make sure that all patients are receiving a quality care that they expect within our healthcare system. So we might have to move them out. This isn't something that is happening at this moment in time, but we certainly could be doing it in the near future.
Ryan, I would say this isn't new. If you think back to when we had some of the challenges specifically in our ICU capacity, I believe here in Regina and then later at Saskatoon, it wasn't uncommon for the health authority and those involved to move some patients back and forth between and use some of our other ICU capacity that we have across the province to ensure that we do have the healthcare capacity that we ultimately need should some other events ultimately happen. So that is why this is not new. I think we can be thankful that what we're seeing in Omicron thus far is, yes, some increased hospitalizations. Many of those are incidental hospitalizations, and not near the pressure on our intensive care units as we did see with the Delta variant. And so for that, we're, I think, grateful in many ways.
And do you have a follow-up question, Ryan?
Yeah, to the Premier, just following up on this truck protest, we've heard your comments on the vaccine mandate itself, but I guess I have a question about the method of this protest. Is a convoy of truckers an appropriate approach when we have empty store shelves and other supply chain disruptions right now?
That is a great question for the Prime Minister of Canada and his government, as this is their policy that is being reacted to. I would encourage all to, in whatever method they're choosing, to ensure they are following all of the laws and regulations that ultimately are in place, which I'm sure transport drivers are well versed with, and they will be as they do that each and every day. But that is a great question for our federal government. Is this policy actually going to in any way produce any tangible results, or is it just going to essentially have a negative result in us not being able to access the goods and services that truckers bring to our community each and every day, understanding that the vast majority of these individuals are already vaccinated, and understanding that they have been operating throughout this pandemic, even at the most trying times, when we saw some incredibly large case numbers in the early days of COVID south of the border. It was our truckers that crossed that border day in, day out, and brought us back our vegetables, our goods and services that we needed in a very trying time in this pandemic. It was our truckers that were the courageous ones that went prior to vaccines, prior to any of the tools that we do have available ultimately here today. So I think there's a much better path forward. Maybe it's one of some dialogue between the federal government and our respective trucking associations, and one I would hope that respects what our truckers have done for us here in this province and done for us as Canadians, not only throughout this pandemic, but in general. And so I hope everyone is following, all of the rules and regulations that are in place. But ultimately, what we're seeing is a reaction to an unnecessary federal government's policy.
And that is all the time that we have for today. Thank you all for taking the time to join us. That concludes today's availability.